Hello everyone. Today we are going to learn about inborn errors of amino acid metabolism or protein metabolism. This is a summarization of inborn error of metabolism of all amino acids that we have learned individually. Inborn error of metabolism. These inborn errors may occur in the metabolism of all the molecules. This error mainly occurs due to defective enzyme. The enzyme defect may be due to gene mutation, resulting in either the enzyme is absent or if it is present in a less quantity. Mutation may lead to inactivity of the catalytic activity, inactivation of this catalytic activity, or decrease the catalytic activity of that particular enzyme. This is Garrot's hypothesis that is suggestive of what happened during inborn error of metabolism. Here you can see A is getting converted into B, B is getting converted into C with the help of enzyme. Now whenever there is an enzyme absent or an enzyme having decreased activity, that leads to accumulation of the substrate, and this excess substrate may direct it to another product or the metabolite that may be toxic and resulting in development of symptoms of that particular inborn error of metabolism. Now let's see one by one inborn errors of amino acid metabolism. The first one is phenylketonuria, in which there is an enzyme defect is phenylalanine hydroxylase. It's a classical phenylketonuria. It's an autosomal recessive condition with incidence rate of 1 in per 10,000 live births. Biochemical changes occurs in PKU is due to this enzyme defect, phenylalanine get not converted into tyrosine, so there will be accumulation of phenylalanine in blood, and this phenylalanine will take an alternate pathway and produces the phenyl lactate and phenyl acetate, and that will be excreted in urine. Hence the condition is called phenylketonuria. Clinical manifestation usually child presented with the mental retardation, along with there is a hyperactivity, tremors and convulsion, hypopigmentation due to defect in phenylalanine. Tyrosine is not synthesized, hence melanin pigment will not synthesize, and this particularly phenyl lactate that produces, it gives a typical mousy body odor to the patient. Laboratory investigations, blood phenylalanine level has to be measured. That is normally 1 milligram per deciliter. Then the ferric chloride test, that is positive. We perform Guthrie's test for the screening purpose, and specific DNA probe test to detect the specific enzyme absence. Treatment. The early detection is very important for the patient with the PKU, and he or she has to be given low phenylalanine containing diet at least for the first decade of life. Now, the second condition is called Alkaptonuria. Again, it is an inborn error of tyrosine metabolism. Alkaptonuria is due to defect or deficiency of enzyme homogentisic acid oxidase. It's an autosomal recessive condition with incidence rate of 1 to 2,50,000 live birth. The biochemical changes occurring in Alkaptonuria is mainly due to excretion of homogentisic acid in urine. This homogentisic acid that is excreted in urine on standing oxidized to benzquinone acetate, and this benzquinone acetate polymerized to form a black color alkapton bodies. Clinical manifestation, it shows a black colored urine after keeping some time. It Patients having ochronosis means the deposition of the black alkapton bodies in the cartilages of nose, pinna of ear, also in the intervertebral disc, and also it leads to arthritis. Laboratory investigation, ferric chloride test, that is positive, and Benedict test, that is also a strongly positive in patient with the Alkaptonuria. Treatment, patient usually prescribed with the low phenylalanine containing diet. Another inborn error of metabolism associated with the tyrosine metabolism is albinism. It is due to deficiency of enzyme tyrosinase. Again, it's an autosomal recessive condition with an incidence rate of 1 per 20,000 live birth. Biochemical changes seen is defective melanin synthesis because of absence of this tyrosinase enzyme. Patient usually presented with the hypopigmented ocular fundus, gray or red iris, photophobia. Patients have nystagmus with a decreased visual acuity. Hair is white and skin becomes sensitive to UV rays, and these patients, they are more prone to develop carcinoma of skin. Other causes for the albinism includes melanocyte deficiency, failure of these melanocytes to form melanosomes, failure of these melanosomes to store and transport the melanin pigment, and also the copper deficiency. The copper is essential for the activity of the tyrosinase enzyme. So again, copper deficiency may leads to defective activity of this tyrosinase and decreased melanin pigment formation. Another inborn error associated with the tyrosine metabolism that includes hypertyrosinemia type I, that is due to enzyme defect, that is fumaryl acetoacetate hydrolase, that splits fumaryl acetoacetate to fumarate and acetoacetate. It's an autosomal recessive condition with an incidence rate of 1.5 is to 1000. It is due to because of this enzyme defect, the biochemical changes occur mainly is defective aromatic amino acid metabolism, that is phenylalanine and tyrosine. Patient clinically present with the mental retardation, having cabbage-like odor and hypoglycemia. This is very important. Cabbage-like odor is seen in the patient with the tyrosinemia. Liver failure, renal tubular dysfunction, polyneuropathy, and rickets. This is also called hepatorenal tyrosinemia. Lab investigation, patient's urine having tyrosine along with para-hydroxy phenylpyryl acid. Treatment, patient usually given diet with the low phenylalanine and tyrosine containing. Now, inborn error of metabolism associated with the glycine metabolism is primary hyperoxaluria. It is due to enzyme defect, that is alanine glyoxylate transaminase, that is due to defect in protein targeting. It's an autosomal recessive condition in which there is impaired conversion of glycine to glyoxylate. Patients usually appear with the renal stone, urinary tract infection, and having severe abdominal pain. Lab investigation, the measurement of oxalate and the other metabolites in the urine, along with that the blood test to show the kidney function and oxalate levels in the blood. Also the stone analysis done after removal of the stone, it's suggestive made up of oxalic acid or oxalate. Usually patient advised to drink large amount of fluid, water. Oral potassium citrate is given to inhibit the calcium oxalate crystallization. Another condition, that is Hartnup's disease. The possible cause for the Hartnup disease is defective absorption and the reabsorption of aromatic amino acids, particularly the tryptophan, from the intestine and ventricles. It's an autosomal recessive condition and in which there is excretion of amino acids in the urine. Patients usually appear with the pellagra-like symptoms due to impaired synthesis of niacin from the tryptophan. Patients also suffer from dermatitis, ataxia, and abnormal behavior. Lab investigation is based on amino aciduria and also the performed Obermeyer test that shows the increased excretion of indole compounds from the urine. The Inborn are associated with the sulfur-containing amino acid metabolism that one includes Homocystinuria type I. It is due to defect in enzyme cystathionin synthase. Incidence rate is 1 in 2 lakh live births. The biochemical changes occurs in homocystinuria is abnormal accumulation of homocysteine and methionine in the blood, and this excess homocysteine excreted in urine. And as we know, this homocysteine is considered as a cholesterol of new era. Patients usually appear with the mental retardation, having Charlie Chaplin gait, that is a characteristic of Homocystinuria type I, having a skeletal deformity, ectopia lentis, myopia, and glaucoma. Lab investigation, the cyanide nitroprusside test from the urine is positive. Treatment, patients given diet with a low in methionine and rich in cysteine and supplemented with the vitamin C in a dose of 500 mg per day. Another metabolic defect of sulfur-containing amino acid metabolism is cystathioninuria. It is due to defect in enzyme cystathioninase. It's an autosomal recessive condition with an incidence rate of 1 in 70,000 live births. Biochemical changes seen in cystathionuria is abnormal accumulation of cystathionin in blood and hence its excretion in urine. Clinical presentation, patients usually appear with the mental retardation, anemia. It sets the symptoms with the homocystinuria. So patients appear with the mental retardation, anemia, thrombocytopenia, endocrinopathies, ectopia lentis, and myopia and glaucoma. Lab investigation. Here the cyanide nitroprusside test is negative, but the cystathionin level detected in the urine. Treatment, the same. Patient given a diet that is having low methionine and high in cysteine, and the supplementation of vitamin B6, folic acid, and cobalamin is given. Another inborn error of metabolism of amino acid is histidinemia. It is due to defect in enzyme histidase, autosomal recessive condition with incidence rate of 1 per 10,000 live births. Biochemical changes shows abnormal accumulation of histidine and alanine and its metabolite, that is imidazole pyruvic acid, and its excretion in urine. Clinically, patient present with the mild mental retardation and delayed speech development. Lab investigation, there is a detection of metabolite, that is imidazole pyruvic acid in the urine, and blood suggestive of increased level of histidine. Treatment, patient advised to give or take diet that is low in histidine. Then comes the maple syrup urine disease, that is a disorder of branch chain amino acid metabolism, that is also known as MSUD. The enzyme defect is branch chain alpha keto acid decarboxylase. Autosomal recessive condition with an incidence rate of 1 case per 1 lakh live birth. Biochemical changes, the deficient decarboxylation of branch chain keto acids that affect the valine, leucine and isoleucine metabolism. Patient clinically present with the convulsion, severe mental retardation, vomiting, acidosis, coma, and usually child die within the first year of life. Lab investigation, blood and urine of the newborn contains high concentration of branched chain amino acid. The urine of the affected child smells like a burnt urine, that is like of maple syrup. Hence this condition is known as maple syrup urine disease, and it gives Rothra's taste positive in the urine. Treatment, diet low in branched chain amino acid is advised. In some cases also responds to the high doses of thiamine. So thank you so much. This is all about inborn error of amino acid metabolism. It's a summarization of all the metabolic defects associated with the amino acid metabolism. In this lecture, we have not covered the errors associated with the urea cycles that I have already taken along with the urea cycle.